Hello everyone! Welcome back again to my channel. So if you are new here, hi, my name is Annie and thank you very much for tuning in. And if you haven't yet, please do hit that subscribe button and let's connect. So today we're gonna be talking about some really simple and easy nursing hacks. I think every nurse must know in order to make our work, smooth and easy. So apparently, all the hacks that I will be telling you guys are the hacks that I actually often, or if not always, use at work. And I also tried to search in the internet to look for hacks. So I've included one or two that I found from the internet. Anyway, we're just gonna go right up and I hope you guys will like it and you will learn something from this video. Okay? So the first hack that I will be sharing you is a hack that I'm sure most of us already know. But for those of you who don't, this is for you. During IV insertion, you are having a hard time, finding a vein. It's just like they are hiding, making the patient so hard to stick. But of course, we all know the trick of tapping the hand. You can just tap, tap, tap until those veins pop out. But after everything you did, even how much you tap and nothing's coming out, you can always do the trick of, using a hot compress, warm compress. You can always use the towel, soaked in hot water, but be sure though that it's not too hot where it will already burn the patient's skin, but enough, to keep those veins pop out. You just apply it in the site and after a few minutes, you should see veins, visible for you to insert the IV. I actually always see this done by the phlebotomist. If they're having hard time really looking for a vein, they will just ask for the hot compress and then apply it on the side. And after some time, of course, they're done because those veins started popping out after that warm compress application. So this trick is especially helpful for those of you who are new in learning the art of IV insertion. So you can just do that. Just apply some warm compress in the site and after some time you can see those veins popping out already. So another trick that probably most of you already know is how to count the respiratory rate, not making the patient uncomfortable. Like, of course, if you will go there and just obviously counting the respiratory rate, how their chest rise and fall, then of course you will make them uncomfortable with that gesture, right? So the trick is you count the respiratory rate actually when you are counting the pulse. While you are counting the radial pulse, of course, you can just sneak your eyes in and count also the respiratory rate, or while you are taking the blood pressure as well, you can also count that respiratory rate so that they won't be comfortable if you are there obviously counting how their chest rise and fall, isn't it? And of course, the easiest way you can count the respiratory rate without making the patient uncomfortable is while they are sleeping. For example, in the morning, you go there and take the vital signs and you see that the patient is still sleeping. You can just count first the respiratory rate before waking them up to take the blood pressure or something, right? That can do the trick. But of course, this is just applicable if you don't have that sensor for the respiratory rate, right? Now, so third trick is, how do you take away, the foul smell of patients with C. diff? Isn't it? C. diff patients has this distinct foul smell if they will poop or something, right? So one trick you can do to take away those foul smelling in C. diff patients is using coffee. Just pour coffee in a bowl or whatever, container you have and put it in the room, wherever you want to. Just put it there. Coffee has this distinct, delicious aroma, but it can actually absorb some other smells in the environment as well. What's the thing with coffee is it has actually a nitrogen content, which helps to neutralize the air quickly and safely. This coffee actually is a very, very effective alternative for baking soda, if you want to take away those foul smell in the room or in the environment. Okay, so the fourth hack actually is a hack that I found from the internet when I was searching. So this is related to the IV. For example, you administered an IV antibiotic for the patient, which doesn't have any continuous IV going on. So after some time, you heard the IV beeping, the IV pump beeping. So you went inside the room and you realized that you have to disconnect actually the IV from the patient because the IV antibiotic is finished. But you also realize that you did not bring that blue cap, if you know what I mean, the blue cap which you use to cover the IVs, the IV lines of the patients, right? So for example, this is the IV line, that's the saline. You have to cover this, right, so that it won't be hanging open there. So actually, most of us nurses usually has normal saline flashes in our pockets. I think most of us, most or maybe all of us has normal saline flashes in our pockets. So of course, you will flush the line right after disconnecting it from the patient. So you can actually use the cover of this one, which is this one, to cover the end of the IV line of the patient so that, as I've said, it won't be hanging open in there. You can just use this one as replacement of that blue caps. Of course, you can just only use this hack. It's not a standard or it's not, the protocol, but you can always use this one as an emergency, or I mean, if you don't have that blue cap in your packet. Okay, so the next hack is actually applicable for confused patient, and I'm sure most of us or all of us even had a confused patient one time or another in our nursing career, right? So with confused patients who are trying to get out of the bed, just walking around the area, even trying to get out of the room, and sometimes disturbing other patients as well, with which even the even watching TV doesn't help, then what you can do actually is give them something to do. I mean, even if watching TV doesn't help, then give them something actually physical to do, like puzzles. I remember I had a patient who was confused, just walking around and trying to get out of the bed, and I was so scared that he might fall down from his bed. So what I did was I found this crossword puzzle book in the nurse's station. So I thought I will just go and give it to him, so at least he will be having something to do. So miraculously, I was really surprised that when I went to give him that, he sat there on his chair answering that crossword puzzle, and he was still for a good few hours. So that gave me actually more time to do other patient care other than going back and forth in his room just to check on him. Because I was scared, maybe if I will go back, he will be on the floor already. So that few hours actually was very, very helpful for me to do some other things other than looking after this confused patient. So that hack actually is very useful for these confused patients as well. There are other things, that you can give to the patient so that they have something to do as well. I actually found in the internet that you can also give towels for them to fold just to make them busy, and distract their attention from doing all the stuff that are actually making them more susceptible to fall and all those things. So yep, those are the things that you can do for the confused patient. Okay, so the next hack is actually a very, very simple one, and I'm sure most of us again knows this, but for those of you who don't, using alcohol swab to remove IV dressings of the patient. This helps a lot. Maybe they will even thank you for doing so. It's like, have you ever experienced, having an IV and it needed to be removed, and you're jumping out of your bed because it really hurts? I'm telling you, I had been in the hospital. I was admitted few times now, and it's really painful if they will take that IV off, the IV dressing off. So what you can do actually is using alcohol swab to wipe off the tegaderm as you pull it off. As I've said, if you have experienced that, it's really painful, but wiping it with alcohol swab as you pull it off, then it's way more less painful than if you won't do it. So that's another trick that patients will actually thank you for doing that. So remember, just use alcohol swab to wipe off the tegaderm while you pull it off from the patient's skin, so it won't be so painful for the patient. Okay, so the last but not the least hack that of course you can incorporate into your nursing care is related again to IV insertion. So if you are inserting an IV for these elderly patients or these patients who has a very fragile skin, you can always put a towel under that tourniquet or anything that you can think of. You can apply it under the tourniquet just so it won't be, in contact with the patient's fragile skin. And another thing you can do this is place the tourniquet over the patient's gown, just so it won't be in contact with the patient's fragile skin again. So you can actually do this even for pediatric patients. Just apply something under that tourniquet just so it won't rip off those fragile skin of these patients. It will actually be very, very helpful for them. So there you go with my simple nursing hacks that you can definitely apply it in your nursing shift routine, which makes your work actually less bothersome and practical, not just helpful for you, but for the patient as well. And if you have other hacks that you can think of, please don't hesitate to leave them in the comments below so we can also learn from you. So there you go with today's video, and I hope you learned a thing or two in today's video. And thank you once again guys for watching, and see you again on my next video. Bye bye.